Welcome back to Ozarks Tonight. On Monday, the Springfield City Council is set to hear a proposal that would possibly raise the age of tobacco consumption and the age that people can buy tobacco products here in the city of Springfield from 18 to 21. So we brought in Jon Mooney, the Assistant Director of the Springfield-Greene County Health Department, to speak a little bit more on this proposed ordinance. Jon, thanks for being here. Tell us a little bit more about this. What types of tobacco products would this ordinance cover?
Sure. Well, first of all, thanks for having me. It's a pleasure to be here. So Tobacco 21, what it does is raises the legal age to sell tobacco products from 18 to 21 years of age. That would cover all tobacco products, from traditional cigarettes all the way through to smokeless tobacco, and it includes e-cigarettes as well. The whole point of the issue or the initiative is to help reduce youth initiation, to help keep young people from ever starting to use tobacco products. And the interesting thing, when we look across the country, this sort of initiative can work. So the anticipated results or impact of this would be it reduces tobacco use among 15 to 17-year-olds by 25%. And 18 to 20-year-olds by 15%. So it's a measure that can certainly make an impact.
Wow, and I think this is definitely topical now because more and more younger kids are using e-cigarettes, and there's a lot of maybe misconceptions around that. Kind of talk about what young adults might not realize about e-cigarettes when they start using those.
Yeah, so there's a lot of really interesting information on this. One of the most important things is that a lot of times young people don't realize that there is nicotine in virtually every e-cigarette that they use. And so they're getting addicted a lot of times and not even knowing that. In addition to that, roughly 2/3 of kids that are using e-cigarettes are also using some other form of tobacco product. And so they have an addiction, and they're using other tobacco products that we know have very harmful effects. And when we look at the average age when a kid starts smoking, in Greene County, that's about 12 and a half years old when they first try tobacco products. And that leads an addiction early on in life when their brain's still developing, and just leads to a whole host of challenges when they try to quit.
Sure. You were telling me before we started taping that most kids actually start smoking cigarettes before the age of 21, and by that point, they're hooked. Kind of talk about what is it about nicotine that makes it so addicting and then so hard to kick later in life once you start? Yeah,
so that's the number that I referenced before was roughly 96% of adults who currently smoke started before the age of 21. So we know virtually everyone, again, is starting that smokes later on in life started as a young adult or even earlier in life. So when we think about tobacco and why it's so addictive, it's that nicotine. The nicotine is a highly addictive substance that's once you're addicted to it, and that addiction can start as soon as one use. So as soon as you start, you can become addicted to it, and it becomes very challenging to quit. And then in addition to that, both traditional cigarettes and e-cigarettes have other things in them that are very harmful that can lead to other health issues. And that's one of the things why public health and healthcare is so focused on trying to reduce that tobacco use in our community.
Sure, and kind of talk about some of the long-term health risks that smoking does pose, because it does pose a lot.
Yeah, so I think the best way to sort of set that up is for the second time, we've conducted a joint health assessment, community health assessment with both Cox and Mercy. And for the second time in a row that we've identified the same set of health priorities for our community. Those are heart disease, lung disease, and mental health. And we've looked at those in the contributing factors. Tobacco is one that contributes to all three of those, either contributes or exacerbates the conditions that are already causing poor health outcomes. And so it leads to a multitude of poor health outcomes and early death and disease because of it.
Sure, and Springfield Public Schools as well had a study this year that said 1 in 5 kids within the district had, between the ages of 12 and 17, had seen someone maybe smoking an e-cigarette device on campus. So, it really is younger and younger kids that are being exposed to this kind of thing. I mean, what is it about e-cigarettes that maybe kids now are deciding to try them younger and younger?
Yeah, I think there's a couple reasons that contributes to that. And I think one of the things about tobacco or e-cigarettes, that there is certainly a perceived cool factor, if you will. So when you and I growing up, there was Joe Camel and Marlboro Man, and I think e-cigarettes are really sort of the new version of that, that they really play up on the sort of the cultural desire and the cultural need for technology. And if you look at a lot of the devices, they really play up to that. A lot of them look like USB drives. One of the most common ones, Juul, looks just like a USB drive to a lot of people. And so I think it plays up to that. And again, when you couple that with, again, some of that lack of awareness that there is nicotine in those, and that they might be becoming addicted, and there is the harmful effects, it kind of snowballs into something that presents us with the challenge that we have right now.
Sure. Now, the Springfield City Council will hear this new ordinance coming up on Monday, and then they will vote on it possibly 2 weeks after that date. Jon Mooney from the Springfield-Greene County Health Department, I want to thank you for coming in and giving us a little bit more clarity on what this ordinance is all about.
Yeah, great. Thank you.
Absolutely. We'll be back with more Ozarks Tonight right after this.